Can congenital hypothyroidism be caused by a pregnant woman on levothyroxine? No. However, if a woman is pregnant and hypothyroid and is not treated with levothyroxine or other thyroid medications, those thyroid antibodies can cross the placenta and cause abnormalities in the baby's thyroid. So it is of extreme importance that a pregnant woman with hypothyroidism be treated. And the TSH level should be under 3. So again, my medical opinion, what I recommend is women who are attempting pregnancy and have a family history of hypothyroid, get your TSH level drawn and thyroid antibodies just to see where it is. And if it's above 3, talk to your OB about whether you should be on some levothyroxine while you're pregnant. Congenital hypothyroidism, what is it? It's very rare, first of all, but a baby is born, one, without a thyroid, or the thyroid is in a location, we call it ectopic. That means that it's in a location it's not supposed to be in. It could be in the back of the throat. It could be in the chest. And as a result, it's not functioning the way it should function. Normally, the thyroid is right here in the neck. Other causes of congenital hypothyroidism, there are genetic reasons or genetic defects where the thyroid doesn't develop. There are maternal medications that cause an irregular development of a baby's thyroid. I already talked about a hypothyroid pregnant woman not being on treatment, but what about a an overactive thyroid gland in a woman who's pregnant? PTU, which is usually the medication we choose in pregnant women, still does cross the placenta and can cause irregular development of the baby's thyroid. As a result, we put the pregnant woman, on the least amount of PTU as possible, because untreated hyperthyroidism while pregnant is a danger also to the baby. So this is the balancing act of medicine. Medicine is not black and white. Sometimes we have very straightforward yes and no, but a lot of times we're trying to work within the boundaries of what's best for the mom and what's best for the baby. Other things in mom is lack of iodine. So iodine deficiency in a woman who is pregnant can lead to irregular development of the baby's thyroid. So mom should make sure that she's getting good iodine intake in her diet or in supplements. She can look in her prenatal vitamin and see what the iodine content is in that. But of note, 20% of us have thyroid antibodies. And those thyroid antibodies, as I said earlier, can cross the placenta and cause irregular development of the thyroids, of the baby's thyroid. So it's easy for your OB or your primary care physician. I would say do it before you get pregnant. Check your TSH level and check your thyroid antibodies. And then good, healthy lifestyle behaviors can help decrease those thyroid antibodies.